Hi, my name is Dr. Melissa Grier. I'm an OB hospitalist site director in California, and I have a important life safe story to share with everyone. About a year ago, I was finishing a 24-hour shift, and at the very end of my call, I received a request to present to the emergency department where there was a pregnant woman who was going to be intubated. That means she was going to need to be put on a breathing machine. Um, I went to the emergency room. Our patient had arrived by ambulance with altered consciousness, and when I arrived, she was completely unconscious. I was able to quickly gather some of her history from her husband. It turned out she was pregnant with twins and about 32 weeks pregnant. Her husband called the ambulance when she wasn't feeling well. When she arrived, the emergency room staff did their job and stabilized her. Shortly after my arrival, her heart stopped. I, with my colleague, were able to deliver her babies while the emergency room team was performing chest compressions. We delivered two healthy baby girls, um, and while we did the delivery, and shortly after the babies were delivered by cesarean section there in the emergency room, the patient's heart started beating again. We were able to finish the cesarean section. The patient was then taken for brain imaging, where it was discovered she had an ruptured arteriovenous malformation, which means she had bled quite a bit into her brain. The hospital staff was then able to work throughout the day to address the bleeding in her brain, and about a month later, she was discharged home with no neurologic deficits, and her babies also were discharged home without any problems. And a year later, they're a healthy, happy family. This patient also had two older boys who have also fortunately been reunited with their mother. I want to highlight that it's imperative that I was there in the hospital. We delivered the babies around 15 minutes after her arrival. If we had not been in-house to respond to this emergency, I am not sure that the patient would have survived, nor would her babies. I think it's all a very happy outcome. Obviously, on the day it was very stressful, and I didn't know what the patient's outcome was going to be, but I'm confident that because our hospital had the foresight to have the OB hospitalist group have not one but two obstetricians in-house. This patient now is doing well with her twin babies and two older children, and her husband able to have a completely full and non-compromised existence. So I hope that this has been helpful. It's not very common for a pregnant woman to have her heart stop, or a pregnant woman to go into cardiac arrest. But it does happen, and it is necessary in that case to deliver the baby so that you can restore blood flow to the patient's brain. And the patient did very well. It was a very moving experience, and I can't quite capture all the emotions that I felt or the emotions that the family has felt, but we are just so blessed to have had a good outcome. But again, I do want to highlight that what was necessary to achieve this outcome was the arrangement um, that OB Hospitalist Group had, not one but two providers there.